Hi folks, it's Jordan Harmon, compassionate behaviorist, here to talk to you about the overall goal of a specific kind of treatment called dialectical behavior therapy. There's a whole lot of technical, jargony stuff we could talk about with DBT, and I do, and I will. I'm kind of a therapy geek that way. But there's also some really common sense ways to talk about this kind of therapy. One of those is the overall goal of DBT, which is to help people find and build a life worth living. This kind of therapy was designed initially to treat people with chronic suicidality, people who felt suicidal most of or all of the time. And the basic premise, kind of common sense, is that people who are chronically suicidal and thinking of ending their life are people who aren't, their life, the way they're experiencing it is that it doesn't feel like it's worth living. So the common sense solution there is to help people build a life worth living, and that their suicidal thoughts, especially in that chronic and pervasive nature, will reduce. And I've found that to be the case as I've worked with clients with this specific overall goal in mind. DBT is usually pretty long process doing this kind of treatment, usually at least a year, sometimes much more. Building a life worth living isn't just something that clients who need DBT, who have severe chronic suicidal thoughts need. People who struggle with substance abuse, oftentimes clients and people that I've worked with that issue, with addiction issues, oftentimes they're people who don't necessarily have suicidal thoughts. However, in a similar way, when they're deep in their addiction and they're trying to get out and trying to find recovery, especially in early recovery, the idea of living their life without that addictive substance or behavior becomes so difficult for them to fathom. And so the idea there would be helping people build a life worth living that's a sober life worth living. And so this is a kind of an overall statement that's a goal, and it's, you really take it one day at a time, as they say in the recovery community, or even one moment at a time. And in DBT we apply a lot of skills to help people connect with their values and to kind of more effectively get their needs met and deal with struggles like emotional dysregulation and really high levels of distress and difficulty being present in the moment, and also difficulty in relationships, which for a lot of us, that's part of our life worth living, is connecting with people that we want to connect with. And so building a life worth living is the goal. That's going to look different for different people. Sometimes the thought of it brings some distress to people when they haven't felt connected to it or when it feels out of reach. And that's where it can be really helpful to have someone help guide you through that. So I definitely recommend and suggest that you find a DBT therapist if these are things that you're struggling with. Find someone in your area. If you're struggling, of course, with suicidal thoughts or plans or intent, call the suicide hotline. Reach out for emergency services. Find help. Talk to someone. It's important. People care about you. People want you around, and things can get better. Thanks for watching, and thanks for being here, and be good to each other and yourself, and we'll see you next time. Thanks.